Hello, everybody, and welcome back to the HerStory TV and the HerStory podcast. This is Gertrude Matcha here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome to our tribe. Before we get started, I would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people today. So for those of you who know me, I'm normally based in Wellington, New Zealand, but I have recently moved to Melbourne, Australia, and this is a traditional acknowledgement of country. I feel really privileged to be here, standing on this land, able to share with the world these amazing stories of women who are stepping forward, changing lives one story at a time, one woman at a time. I also want to acknowledge my own ancestors, those who came before me, who made me the woman that I am. So, my next guest, please tell everybody your full name, where you're based, how old you are, and share your story with us today.
Hi, everybody. I am so happy to be here and thankful that I am able to share my story. My name is Jill Beavers Kirby. I go by Dr. J.B. Kirby. I'm a doctorate prepared nurse practitioner who is a very proud 55 years old, and I currently live in Phoenix, Arizona in the U.S. I wanted to share my story today about my experience with COVID. So I've been in healthcare for 37 years. I started when I was 18. I became a firefighter and a paramedic. Then I became a registered nurse, then became a nurse practitioner, and then ended up getting my doctorate. So in February of 2021, I was diagnosed with COVID at one of the little walk-in clinics. I let my primary care provider know that I had COVID, and he called me in some antibiotics, some cough medicine, and some steroids, because at this time we weren't quite sure exactly what a person needed to be treated for COVID. And of course, as a nurse practitioner, I have all the little bells and whistles here at my house, and I had a pulse oximeter. That's a little thing you put on your finger to see what the oxygenation is in your blood. So I dig out my pulse oximeter, and it's reading in the low 80s. I assume it's broken because it's old. It's been sitting around in a closet for a while. So I get on my trusty computer and order Amazon and have another pulse oximeter sent to me the next day. So I get the brand new pulse oximeter, and it's also telling me that my oxygenation is in the 80s. Normally, you want this to be 90, 95, 99, 100. Mine was in the 80s. So I remember telling my husband that I was just so tired, and I was continuing to work during this whole time. As a nurse practitioner at that time, I was working from home, seeing patients via telemedicine who had addiction issues. And I didn't take any time off. Like I said, I just kept remembering telling him how tired I was. But I was seeing patients back to back, no breaks, very busy, just didn't have any time. So then I'm not exactly sure what happened, but we decided to call the ambulance. We called 911. And because COVID was so rampant in this area, they asked me to sit out front on my porch to wait for the paramedics to come and assess me. The last thing I remember was the paramedics rolling me into the back of the ambulance. So what they did was they took me to the hospital. I was admitted immediately, and a few hours after I was admitted, my lungs and breathing became so bad that they had to put me into a medically induced coma, where I stayed for about 3 weeks on full life support. So it was during this time that I had all these weird dreams and things that I saw, and all these just weird things going on in my mind. However, one of the things that was consistent during this time was a Caucasian male who was sitting at my bedside every day. And I I'm under the effect of medications, of heavy medications, of paralytics and anxiolytics and medications. So I wouldn't remember everything that they were doing to me. But I remember this man sitting beside my bed every day. I couldn't figure out how come this stranger who wasn't affiliated with the hospital could sit at my bed, but yet my family couldn't come to visit me. So this man told me his name was Kevin. He looked to be in his mid to late 30s, maybe early 40s. He had brown hair. And when he was there, the television would always be on because he told me that he used to have something to do with the commercials for one of the networks here in the US. I don't remember if he told me, maybe he didn't tell me, but he would have all of his computer equipment. He would have boxes, big boxes that you would like carry your laptop and other computer things with you, like editing software and things. And those boxes would be sitting in the room also. He told me that when he worked for the network, he had something to do with the commercials and how the commercials got put into television shows and how they were timed out and everything. But it turns out as every day went by and I'm still in this medically induced coma and Kevin is showing up every day, turns out that Kevin was my guardian angel. Now, as a registered nurse and as a nurse practitioner, I've spent the majority of my career in critical care units, working and taking care of patients who were critically ill in that same scenario, put on a ventilator in a medically induced coma. And these, patients, when they came around and would be woke up and they would be recovering from their illness, they would say, "Oh, there was this woman who sat by my bed every night and her name was so-and-so and she looked like this." And as a healthcare provider, I'm not going to say, okay, that's impossible. There's nobody here at the hospital with that name or who looks like that. I'm not going to tell a patient that. Whatever you want to believe and whatever you need to tell yourself so that you heal, totally fine. So I never really put a lot of faith into what people told me. I never really asked patients, "Oh, tell me more about this person." I would just let them tell me their story and, do my duties and move on to the next patient. However, now that it's happened to me, and I know without a doubt that that man was my guardian angel and that he was there keeping an eye on me, I will never doubt another person or another patient when they tell me that they've had a similar experience. So I have had several friends who have lost loved ones, their adult children, their adult sons to either accident or illness or injury. And I never could understand why young people who had so much to contribute to life and had so much life left to live died. But now that I've had this experience of having met my guardian angel, I believe that those people who do die young are there because they need to be somebody else's guardian angel. So I also have seen like Kevin's face in the clouds. Here in Arizona, we have beautiful sunsets and beautiful sunrises. So I always try to go out and take pictures of either one of them or both. And one day I was sitting out in my backyard and I looked up at this cloud formation and it was just kind of weird. I was like, that's just a really weird formation. Let me go get my phone and take a picture. And so I took the picture. And when I looked at this picture on my computer several days later, I could see Kevin's face in the clouds. And my oldest son happened to be visiting at the time. And I go and grab him and I'm like, "Look at this picture. Do you see this? What do you see in there?" And he's like, "Oh, I don't know, maybe a face or something." So I said, "Yeah, look, here's this picture. This is Kevin. This is my guardian angel, Kevin." But it was a very surreal experience. Like I said, I was in a coma for about 3 weeks. I spent another week in the hospital. Then I spent a month in rehab. I had to learn how to swallow, how to chew, how to walk. It took me 3 days to figure out how to use a telephone. I eventually went back to work after a couple of months of healing, and I started off part-time and then eventually went back to work full-time. But now that I know why guardian angels exist, and now that I can reason why the good young people have to die so that they can help others in their lives, it all makes sense to me. And it has given me such a sense of peace and understanding, and just that I want to be able to share this with other people so that they know that, yes, there are people looking out for you here and above, and that there is a reason to what we might think sometimes is madness. So it's because of my experience in healthcare and all the years and all the people that I've been able to help that I have, I'm still continuing to work full time as a nurse practitioner. I have also started a website to provide just health and wellness information in an easy to understand format. I hear from my patients so much about how, can you explain this to me? Can you explain that to me? I just wanted to be able to help people and help them understand what's going on with their health. Why are they on a certain blood pressure medicine? Why are they feeling the way they do? Why do your hormones change as you get older? Just those kinds of everyday questions that I hear from my patients. I write stories up about that so that people can understand their health information in an easy to use format. And that's my story.
Absolutely wonderful, Jill. Wow, what an experience you've gone through, though. You know, for people who've never had a near-death experience, this could sound unbelievable, far-fetched, but I've had a similar experience. I collapsed with congestive heart failure while on holiday in a rice field in Indonesia.
Oh my goodness.
I was in intensive care for 5 days and felt a presence that was there beside me the whole time. And I'm here to share that story as well. Now, COVID is a very frightening thing. There's so many of us unsure what is out there, what it feels like. Can you share a little bit about how it's impacted and affected you on a physical level?
So, yes, I feel that it has taken me a complete year to recover. And I'm not back to 100%. I'm definitely not back to where I was pre-COVID. I have a new baseline now. But over the past year, I was pretty healthy. I have some arthritis issues, but other than that, I'm healthy. I don't have high blood pressure, diabetes. I don't have anything going on other than some arthritis. So I never smoked. So for my lungs to be impacted that bad, that quick was kind of surprising. But since COVID, unfortunately, I've had about 10 or 11 severe infections. And there's studies coming out that are showing that this is sort of common among people who've had serious, significant COVID issues. I've had 8 urinary tract infections in the past 12 months. And I'm not a person who gets urinary tract infections. You know, some people are prone to them and some people are on medicine to suppress it. That's never been me. And I get an infection in my intestines called colitis. And I've been to different doctors, different specialists for both of those issues, and they're trying to figure out why this keeps happening. And the overall arching issue is, well, this is your new baseline. Your immune system is still probably not back to 100%. The other issue I have, while I was hospitalized, once they stopped the medicine to put me in the coma, it took a very long time for me to wake up. And I was very confused, very, very confused. I thought I was in New York City. I thought I was in Illinois. You know, the whole time I'm in Phoenix, Arizona. And I would tell them, they would ask me, where are you? And I'd be like, New York City. And they wouldn't correct me. They would just be like, okay, she's in New York today. But I do have some memory issues. Like I said, the last thing I remember from that event is them putting me into the back of the ambulance. Events prior to that February day, like what I did that previous Thanksgiving, what I did that previous Christmas, were gone. My friends and family have helped me fill in some of those blanks, but I do still have some issues with memory. So I take a lot of notes, write a lot of things down. If I'm, working with somebody, I'll tell them I apologize if I've sent this twice because, I've got some memory issues now. So they are finding, like I said, there are some scientific studies being done that these issues are common amongst people who had serious COVID and among the long haulers. So the last time I had a bad infection was January 27th. So it's been almost 3 months. So that's awesome for me. So I'm hoping my immune system is getting stronger.
Yeah, it takes a while. Now, to go back to the presence of angels, you are a scientific woman. You came from a scientific background as a nurse, your clinical training. What did the presence of this angel feel like? I have always said to people, I've had a spirit-led life. I am told to go left or right. And if I follow that voice, I've avoided catastrophic events. I avoided a mass shooting when I was in South Africa once because of that voice. Some people don't know how to tune into that guardian angel. What have you learned since this that could help other people?
I'm trying to think back how I really felt about that. Like I said, when patients would tell me about people being in their room and sitting by their bedside while they were out of it, I would just kind of look at them like, oh, okay, fine. I didn't say that's crazy, that doesn't exist. What are you talking about? I never wanted to make them feel bad about their idea because I truly believe that whatever you think is going to, the power of thinking. And if you think something's going to help you get better, then by all means think it. Medicine is called the practice of medicine because we're still practicing every day. We're still learning new things every day. There are no absolutes in medicine. And I've learned that over my 37 years. But now when I do hear and I think back to my patients who have told me about their experiences, now I wish I would have asked them more. But it has definitely changed my thoughts on how I look at life. I realize life is very short and I'm not going to settle anymore. I'm going to do what I want to do when I want to do it and how I want to do it. If I want to go visit somebody, take a trip and go visit somebody across the US, I'm going to do it. But I've also learned not to fear death. I've learned that I am here. I'm experiencing life. I'm going to make it the best I can make it. And when I die, I die. And I hope my family will look back on, my life and say, she lived a full life and she was happy in her life.
That's beautiful to know. Yeah, you're right. This life is very, very fleeting. And the sad thing as human beings is we think we have control of our lives and we don't. It's a gift that we have to use to the fullest while we have it. So you've had quite a few little wake-up calls there and knowings that have come out of this experience as well, which is absolutely beautiful to observe. So if there was somebody who's listening in right now, who has family, who has a friend, who has a relative who's sick with COVID, what advice could you give them so they can pull through this difficult time?
I would recommend that if they have a higher power that they believe in, then pray to that person. I come from a religious family, a Christian family, a Southern Baptist family. And I know my family sent out a lot of prayers and involved me in a lot of prayer chains. So I would say keep believing, never give up hope. Listen to what the medical professionals are telling you, but don't be afraid to ask. Don't be afraid to say, what if we did XYZ instead? Or what if we didn't do XYZ instead? As a consumer of healthcare, and me being a healthcare provider, you're essentially hiring me to do a job. So it's totally okay to ask, what if I don't start that medication? What are my other options? what if I don't get that test done? How else can we look at that? And I encourage people to question that, just like they would question somebody working on their car. You would question the mechanic. Do I really need to get that done right now? It's okay to ask your healthcare provider the same thing. Do I need that medicine? Do I need that expensive test? Do I need to do this procedure? Or what are my other options? So it's totally okay to ask about other options. Like I said, continue to believe in your higher power and pray, and just never give up hope.
Yeah, hope is the one thing that sustains us, that keeps us going. So I'm hoping that if there's anybody out there who has listened to this interview, you have been empowered with a few little nuggets of wisdom on how to move forward. Jill, what you've gone through is phenomenal. I'm just so glad that you are living life to the full. And that's the thing that happens when you have this brush with death, right?
Mm-hmm.
There's no holding
Yes.
back. You do what you want, you experience what you want to experience, knowing that this life is fleeting and you might not get a chance to do it again. So thank you so much for coming online, Jill, and sharing this with us. Thank you to everybody who's tuned in today. COVID is affecting all of us, no matter where you are in the world, whether it means you get it or somebody else gets it. This is an amazing video that really gives us hope that there is light behind COVID, that you can survive it, you can move on with your life. So Jill, don't go away. I'm just going to say goodbye to everybody. I will be back again tomorrow with yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And bye for now.